Suggested NexWave IFC and TENS treatment protocols. Suggested IFC treatment protocol. Knowing when to use IFC over another treatment option like TENS is important to maximizing your pain management. In general, if you are able to fit 4 electrodes around the treatment site, then we suggest starting with an IFC treatment. Treat with IFC every 4 to 6 hours for 30 to 40 minutes per treatment. Remember to set your stimulation level to a strong but comfortable sensation. If pain persists after treatment, TENS can be used immediately after. You can use TENS immediately after an IFC treatment if the pain symptoms are still present. Also, use TENS when the treatment site is too small to fit 4 electrodes. It is a good idea to use TENS when there are 2 different pain sites to be treated. In general, use TENS as needed for pain relief anytime in between IFC treatments. Thank you for watching, and please visit our website for more helpful information about how the NexWave can help you manage your pain symptoms.